Hello and welcome back to Patient Knowledge. My name is Dr. Kirmani, and this channel is all about health education. For my new viewers and subscribers, I would like to mention that on every Saturday and Sunday, I upload new videos about specific health conditions. So if you don't want to miss out on that, subscribe to my channel. Also, like and share to as many people as possible to spread the knowledge. Well, today I have chosen an interesting topic that affects our hand. It's called Carpal Tunnel Syndrome. So let's get started and check it out. In this video, I'm going to be talking about what's Carpal Tunnel Syndrome, who gets it, what are the symptoms, how can it be diagnosed, are there any risks involved, and what's the treatment. Well, what's Carpal Tunnel Syndrome? It's a painful disorder of the hand that's caused by pressure on a very large nerve called the median nerve as it passes through a tunnel at the wrist. Now, median nerve is one of the major nerves that supplies your hand. It begins somewhere in the neck and then passes all the way through your forearm, and then in front of the wrist, it passes through a narrow tunnel or passage before entering the hand and supplying the thumb, index finger, middle finger, and half of the ring finger. Now, this tunnel is formed by the wrist bones on the bottom and sides and a band of fiber on the top, forming the roof of the tunnel. Median nerve passes through this tunnel and it supplies the muscles of the palm and the base of the thumb. It's responsible for the movements of the fingers and thumb and is also providing sensations or feelings to the thumb and the nearby 2.5 fingers. Now, who gets it? Women are 3 times more likely to get carpal tunnel syndrome. It's seen commonly in pregnancy. It can happen due to injury to the wrist. It can also be present in people who have medical conditions that causes inflammation such as diabetes, rheumatoid arthritis, and hypothyroidism. Now, people who are involved in doing repetitive hand or wrist movements such as farmers, factory workers, or those who have to do typing work for long hours are more prone to get this problem. What are the symptoms? So, people who are suffering from this condition, they usually complain of sensations of pins and needles in the hand, pain in the upper arm, pain especially during the night. They complain of waking up at night with pain and tingling numbness, and when they shake their hand off, they are relieved from the pain. So this is typical of carpal tunnel syndrome. People with carpal tunnel also complain of loss of strength, have a weaker grip strength, and have tenderness in the forearm. So if you have any of the above symptoms and you're not sure about it, because tingling and numbness can happen due to many causes, it's better to see your doctor and get yourself checked. Now, what will your doctor do is they will assess you by taking a detailed history about your problem and look into your health condition, and will do some clinical testing. This testing involves provocative testing of the nerves, where they tap on the nerve directly to reproduce the symptoms or cause an activity that will cause compression of the median nerve. These are the tests called as Phelan's test and Tinel's test. Now, if the tests are not sufficient enough to satisfy the doctor about the diagnosis, they may sometimes ask you to get a nerve conduction study done. This is a simple test where they're going to check the function of your nerve and look for any damage to the nerve. This is performed by special machines. You must be wondering if there is any risk involved. Well, if this condition is left untreated and it becomes chronic, then it can cause permanent weakness and numbness of the thumb, index, and middle finger. These are the exercises recommended for carpal tunnel syndrome. What's the treatment of this condition? Well, it depends upon how much impact it has on your life. If you have very little impact and you can manage with conservative treatment, doctors would ask you to get enough rest, take some painkillers like nonsteroidal anti-inflammatory drugs, or if you have some fluid retention, they will give you fluid tablets to get rid of the excess fluid. In pregnant women, splinting is the answer. Putting a splint at the wrist at night times gives a lot of relief from the symptoms. Well, those who are suffering from rheumatoid arthritis will benefit from cortisone injections that are given directly onto the nerves to relieve the symptoms. If these measures are not helping and it's a chronic problem affecting your day-to-day activities and your quality of life, surgery is the answer. Doctors will perform a surgery. It is simple and easy. It's a day procedure where the idea is to cut through and decompress the nerve. This will create a bigger space for the median nerve. It is usually a simple surgery and the recovery is better, and this takes around 4 to 6 weeks. Well, that's all for today. I hope this information was helpful in understanding everything about carpal tunnel syndrome. Thank you for listening. Bye for now.